Uh, Good morning, everyone. I'd like to open the committee on COVID response and efficacy, the special committee. And the duties of the mission of this committee is it is a bipartisan committee, is tasked with investigating and evaluating the state's response to the COVID-19 pandemic. The committee will function in a science-based fact-finding review, specifically acquiring comprehensive, accurate data and all related information pertaining thereto. Areas of particular focus will include the administration of federal guidance, acceptance of federal funds, and implementation of emergency use authorization vaccination efforts. A report will be issued outlining the committee's findings and the impact on New Hampshire. I would like to call on Representative Lekis to lead us in the pledge, please. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We do not have any speakers lined up today, but I do want to let the committee know that we will be meeting on May 16th, starting at 10 a.m. It will be a full-day event. We also have Commissioner Caswell coming in on Friday, May 17th at 2 p.m. And I would like to, this will be mainly a work session to discuss what we've learned thus far, discuss our report and any other issues that are pertinent to this committee. I open. Representative Belcher.
Thank you, Madam Chair. Good morning, everyone. So I think we've learned a good number of things so far. And one of the things, though, I would like to take a little time today to do is to supplement our mission statement in this committee, which identifies sort of what we're looking to accomplish and the scope of what we're investigating and looking at, with a bit of a jaunt through the New Hampshire Constitution to help us identify our purview, our capabilities, and what actually could be done conceivably. Not that we'll take every measure, but could be done as a part of that.
Representative Belcher, when you say supplement our mission statement is pretty clear, but can you expand on what you mean by that?
Yes, perhaps it wasn't the best choice of words. What I mean by is our mission statement outlines the items to be looked at and investigated, what the scope of our committee is looking at. But everything we do within that scope is done according to the New Hampshire Constitution. So I think it would be a good idea to also look at the New Hampshire Constitution to say, okay, within the scope of our mission statement, what capacities do we have as a committee? What remedies might we offer ultimately as a part of this committee?
Does the committee have any objections?
No.
Okay, please proceed.
Thank you, Madam Chair. So just looking to the State of New Hampshire Constitution, I've got it all pulled up here on my computer. We can go through each section that is pertinent to what we're doing. Shouldn't take too long to do, but I think it's good to look at. Let's see, we have under State Constitution, form of government, we have Article 4, the power of the General Court to establish courts. It is within the purview of this body, this legislative body, to establish courts of record, to handle any issues that need to be adjudicated in this state. And again, I'm not suggesting that we will, for the audience, take every measure. We're just simply going through the Constitution, saying this is what we have as a legislative body. So we could eventually, if we wanted to, recommend the creation or the establishment of a court of record to deal with any issues relating to what we might find. We have the power of legislation. We can, under House rules as they currently exist, we can't issue legislation without a suspension of the rules, but we can certainly make recommendations for legislation going forward. to be introduced at a later time. We have the we have the power of taxation. I don't think we need to look too close at that one in this committee right now. Let's see. As far as we have the powers and also the duty to address grievances from members of the public. So as we have received or receive in the future grievances that are related to our mission in this committee, we can examine them and investigate them and make recommendations for how to move forward with any appropriate redress of grievances. We can find that under the Bill of Rights. We can, let's see here. I believe under a reading of Article 83, we have the capacity to make recommendations to the private sector as well as institutions of education and otherwise for any needs that we may come across. For instance, if we were to find that there's a glaring scientific need for research into a particular item, we can make recommendations to the institutions and public sector to pursue those.
So something to the effect of recommending specific guidelines for air filters to help mitigate viruses. Would that be one of those items that we could recommend? Or I'm just trying to understand when you say
I believe,
that.
strictly speaking, something like that would be addressed through legislation. This, I think, is more in terms of if we discovered, for instance, that there was some problem that came up as a part of the vaccine rollouts or something to that effect that rendered us with a problem within the broad body politic. We could, instead of dealing with directly legislation, we could say, okay, we have a bunch of universities in this state. They do a lot of research. We can appeal to them. It's not a mandate. We can't make them necessarily do this stuff, but we can appeal to them to consider investing some funding and time into investigating this particular matter to look for solutions, because that's just part of their charge under what they do.
So similar to people that switched over to make hand sanitizers during the pandemic period.
Sure, yeah, and there was I believe executive orders that provided some relief from regulation that allowed them to pursue switchovers like that. And that's something that we could. I mean, there's nothing stopping us as well from making recommendations to the executive branch for executive orders or as well as exercising our oversight of what has occurred. Making recommendations for future if there is another emergent event or pandemic that comes up, as well as exercising judicial oversight, and also exercising oversight over our state-federal relations. What kind of funds were received, what kind of mandates or you might say strings came with any of those funds, and whether there is anything in the future that needs to be done differently. Those can be all within our purview, I believe, comfortably within our constitutional mandate as a committee.
Does anyone have any other comments relating to what Representative Belcher was just discussing? Representative Villekas.
I think it's great spelling out our powers more specifically according to the Constitution. Thank you, Mike.
You're welcome.
Is there anything else that anyone would like to discuss regarding our duties or how we're functioning, things that we're doing right? Anything further that we need to discuss, Representative Olazov?
Well, just a thought that I had as I was listening. We mentioned the power of taxation, and it's definitely that people are already taxed enough, but also like my thought was that one of the problem that we heard here and otherwise is that people who are injured, for example, by vaccines, are having trouble receiving proper compensation, even though government established, federal government established a special fund for those purposes. So I just wonder if the fund is not enough, and that's why people are being tossed around, or other reasons why it's that process is so onerous on victims. Just a thought. So probably because it's already inside the government, so probably it's not a case of additional taxation that is needed, but something to think about.
Representative Belcher?
Thank you, Madam Chair. And I would just add to that, speaking directly to the audience, the general public, that what we're doing as a committee, obviously, we established this committee. We asked to establish this committee. We want to move forward with these investigations. But we're doing this primarily based on the public, based on grievances, based on petitions, because we've heard from you, and we would like to continue to hear from you about any items related to our purview within our broad investigation of the COVID efficacy and our state response to COVID. So for those listening, if you have items that you think were done well, or items that you think were not done well, items that you think may have been in violation of your rights, or anything of that matter, we do receive grievances. If you have petitions for us or anything of that nature, we are happy to accept those and look at them and to see if they fall within our purview for our duties here. Thank you.
Representative Blekis?
Can you go over what specific things we'll be covering that we have scheduled already? And if there are any days that we have scheduled for the public to be able to come in and answer Mike's questions,
So
Representative Belcher's questions.
thank you for that question. First off, I'd like to let everyone know that if anyone wanted to email this committee, we are a standing committee under the New Hampshire House, and they can go on there and click there and send an email to anybody in here, in this, it has all our contact information. So they can send an email to the special committee specifically. May 16th, we will be having a full day, and I don't think there'll be any time for, the topic will be dealing with federal mandates and also the vaccine rollout, I believe. We have a speaker coming in who is well-versed in a lot of what our mission is. So I think they will have a PowerPoint presentation. On the 17th, Commissioner Kaz will be coming in at 2 p.m., as I mentioned earlier. And he will be discussing the federal funds or the funds that were dispersed through Gopher. And I am sure he will be able to speak also to that guidance of how it was rolled out. And if there are any questions from this committee, if we could get those specific questions together for him. I know Representative Ebels already has some questions that she would like to see answered. If anyone else here, I can send those out to him to give him a heads up. But he was instrumental in issuing the funds through the state. so that everyone knows. Earlier in that day, if we decide to meet earlier that day, there'll be room for the public. And right now, those are the only two dates currently scheduled. I'm possibly looking to schedule a Tuesday at some point. Not sure which Tuesday would work for everybody, if Tuesday would work for anybody here, because once we get past this through the 16th, I believe all House deadlines have had to be met with regards to bills. And then I believe it would just be special hearings. We are still trying to get Director Buxton to commit to a date. That's why I'm thinking of a Tuesday. And if we can get a specific Tuesday, I'm sure that he won't be here a full day and we can have the public come in at that time. But if there's anybody that would like to come in and speak, and if they could just reach out, and then we could schedule meetings just to hear from them. If we have one person, we can put them in with somebody else. If we have several people, we could do a day just for the public to come and discuss what's going on. I think having the mom here the last time we met was really eye-opening. As I had said, it was heartbreaking, but it was also insightful into the response and how it affected children, how it affected families, how it affected personal relationships, etc. And to touch on something that Representative Polozov talked about, with respect to getting reimbursed through the government-funded site, because of the time frame, they were not able to do so, I believe is what she had mentioned. I would have to double check her testimony, but Representative Polozov.
Just follow up on that, so that it's probably not an issue of taxation, that there's not enough taxation, because some other funds were over, over permissive and issuing funds. We know that many small businesses were receiving compensation for being closed, and there was a lot of fraud when some non-existent businesses, some fictitious business names were used to receive those funds, and the fraud was so huge that government doesn't have resources to go after every case of that. So we see that in some cases, like some compensations and other COVID response related funds were distributed too freely, but in some cases, I feel like there was too much tension.
Representative Lekis?
Is one of the speakers who's coming on the 16th or 17th able to answer how those decisions were made so that we make sure if this ever happens again, we have a process that doesn't allow for that fraud?
I think that that would be more of a question for Commissioner Caswell on the 17th and or Director Buxton, who is also with Homeland Security in New Hampshire, who handled the federal funds. There was a lot of money flowing through the state and from the federal government. So I know that, and there were many, many people trying to get their hands on money, even if they weren't entitled. It's unfortunate, but that was the way it was, and that's just society, I think, and we'll always see fraud, no matter what's going on. There are people that they try really hard at it, as we hear about that all the time. And I don't think that would be the purview of this committee, to look into that. That would just be too onerous. That would have to be another committee, to look into things like that. Because our focus really needs to be on the administration of the federal guidance, the acceptance of the federal funds, the implementation of the emergency use authorization vaccine, and how that affected different areas. As we know, it affected education. It did affect the private and the public sector. It affected everybody technically. But I think for us to really look at the abuses in the federal funds, we just wouldn't be able to do, I think, what is really the focus of this committee. So, I mean, I think, we've learned a lot so far, even though we've only had a few meetings. We had the industrial hygienist in here, Steve Petty. And I learned more about masks than I ever thought that I would know. I learned about microns and droplets. And I didn't know that the reason doctors or surgeons wear masks is because of droplets, and that's why they've always worn them. I didn't know that on an N95 mask that you had to be professionally fitted for that. And I think that is a really piece of important information. And I think that the information that we learned about masks should be one of the topics in our report. Because what we did learn is that the COVID virus was, I forget what the number of the micron was, but no mask that we had readily available to us could actually prevent that, stop that virus from being expelled from us, or even with the mask on getting into us. And I think that's really important to understand. And I think in the future, when we're going to implement policies, we need to look at that and say, gee, is this a virus? And if this is microns, what is the effect of that? I think that's important for the public to understand, and so that we don't have a false sense of security, in my opinion. Because of that, Representative Belcher.
Thank you, Madam Chair. And just to follow on with what you were just saying, I think there is a trend or something that's been ongoing in the judiciary at the federal level recently, which parallels what you were just sort of talking about, which is, if you'll give me a second to explain, the idea of an intermediate versus a strict scrutiny, which is used in adjudicating cases oftentimes in the judiciary with, and forgive me, these are paraphrasing these definitions, but the idea being that where constitutional rights are implicated under a strict scrutiny paradigm, there is an extraordinarily high level of burden of proof placed on the government that it is wholly necessary to do this, whatever this is, to override that individual right, versus a more intermediate level of scrutiny, which merely suggests that the government only have to prove that it might be useful to do so, basically. Not perfect definitions. I don't have them up in front of me, but the idea being that perhaps, and this is something we'll discuss, I'm sure, when it comes to issuing a report, but perhaps there needs to be some sort of a recommendation going forward that anytime individual constitutional rights are implicated, we need to be operating more along the lines of a strict scrutiny than an intermediate scrutiny, where we really have to have a burden of evidence that is significant on the part of the government before we can simply tell people you have to do this or you cannot do this.
Thank you for that. That's very helpful in explaining to myself, I'm sure as to others, on how things are guided. I also think on that lines is what we did learn regarding mask is that the medical profession isn't the one that understands masking. They understand medicine, and they're a specialist, and that understand how masks work. And I think one of the things that, and I'm not sure, and I'm sure we'll find out as we have people in from the state on how they receive the federal guidance, and did they do their own investigation, and did they bring in their own specialist in those areas, or did they just take the word and said that this is the way it is? Because again, what we heard from the gentleman that was here was that when all of this was happening, he went into a school that was a special needs school where the masking issue was going to create a serious problem, and they instituted protocols where they didn't mask at all, and they had 0 cases of COVID. I think I didn't even know that there was a whole industry out there that specialized in masks, understood the different properties of masks or anything like that. And so for me, that was extremely enlightening. And I'm sure for most people, they would think that, your medical profession would be the ones that would understand that. But they receive guidance from these specialists. So I think one of the things that we need to look at and we need to ask going forward is, are we bringing in the proper specialist to give us guidance? Representative Belcher.
Thank you again, Madam Chair. And again, I'll follow up a little bit on what we're talking about here, because I think there's two completely unrelated, very important points to pull out of what you were just saying, which is we looked, from what we've gathered so far, very myopically, a very narrow focus on one set of ideas about how to contain the outbreak of COVID. We settled on primarily masking, whereas what we've heard is very few places took a more sensible approach of environmental controls, where an item that would have had minimal impact on anybody's individual rights or their ability to choose whether or not to wear a mask was overlooked in so many cases, and probably would have resulted in a less expensive and higher efficacy path forward. So that's something we'll definitely want to take a closer look at. And the other item was, this is important as well. One of the things I'd like to get more information on regarding a lot of these mandates that came up for various places, I wonder to what degree litigiousness played into various decisions, because we do have somewhat of a litigious society at the moment, perhaps not as much as back in the 90s, but was there a fear of lawsuits that drove some of this, what you might call safetyism, that drove certain requirements on people to do various things? And because this brings up a very important point about what we just went through as far as our constitutional abilities. Again, inside Article 83, we have the ability and the duty to offer immunities where necessary to protect people's rights. So what that might mean is something we could consider recommending if we discover that there was any degree of litigiousness or fear of suits behind any of these mandates. We could consider legislation or something of that effect in the future offering immunity from civil suit in situations where individual rights would otherwise be overridden with mandates. For instance, hospitals They wouldn't have to worry about being sued if they don't force people to wear a mask or be vaccinated for COVID or whatever it may be. We have the ability to offer these civil immunities that might be able to protect individual rights better.
Representative Belcher, just a question regarding that. The hospitals instituted a strict protocol where no visitations to anybody in the hospital. Would that be something that you're speaking to?
That would be at least adjacent to something that I'm speaking to. The idea, I'd have to work it out exactly how that issue might work in this regard. But for instance, if you were saying a hospital is now being told by some higher entity that they should block people from being able to access patients in the hospital in order to do infection control. Well, now you've got a should. It's not quite a mandate, but it's a recommendation coming down from perhaps a federal level or some other organization. Well, in theory, if they don't do that and now you have a problem where there's an outbreak or whatever, in theory, you could have a lawsuit on those grounds saying you failed to follow this guidance. So did litigiousness in that kind of an instance drive these policies? They may have. I'd like to know more about that. But one thing we could do is write legislation that says people have these rights to be able to do these certain things. Perhaps we could say that we believe people have a right to visit their loved ones, especially when they're ill, they're dying, whatever. And you will be immune from civil suit if you allow this to happen.
Not to be adversarial. However, do you believe that there are cases of highly contagious diseases where people should not be able to go into that section? Just
Thank you. And that is a bit of a complicated question because you have, differentiation between something like COVID, flu versus Ebola. So those are very, very difficult questions to answer, but I would always err on the side of individual freedom and say if somebody has somebody who's sick and dying of a very contagious, nasty disease, if there is any ability whatsoever to fit that person with adequate protective controls to prevent the spread of infection, then I think they probably ought to be allowed to do so, waiving any right to a civil suit if they were to contract something in order to be there to hold the hand of a dying loved one. I think even with some of the more severe diseases, I think that could be appropriate, again, if they can be outfitted with the proper protective equipment.
okay, so as long as they're operated, can be with PPE, then you're saying it's okay, because my concern would be that in the case of Ebola or something, that there was something and they went out and they spread that into the public. So I think we have to be cautious. I understand COVID is different than Ebola. And I think that's something that we need to look at, right? I mean, we need to look at COVID is a virus. I personally call it the flu on steroids. But it is deadly for some people, as is the flu, as is pneumonia. I mean, we have all kinds of viral and bacterial infections that are deadly to certain parts of the population, depending on age, depending on complications and different health issues. And the other thing that I think we learned is that from COVID, from I believe it was Dr. Kuldoff that talked to us, is that based on what we know the population that was most affected, and we know the population And I'm not sure how quickly we learned that, but I think we learned pretty quickly who wasn't getting COVID and who was. And I think that's something that we really need to, in the future, really maximize on. Because, yes, we needed to protect our elderly. And I think New Hampshire did that pretty well. I mean, that was our first population that we looked at, and I think that was a really, really good thing. But we also know that the younger people aren't as affected by this and really weren't catching it or even transmitting it, is my understanding. So, and we know that the next one coming down the pike could affect a different population. We don't know what population it will affect. But I think in when we give out our guidance, we need to be looking at, it's not necessarily the entire population that's going to be affected by something. It's usually targets certain sectors of the population. And I think that's something important to note. Representative Lecker.
Yeah, I just want to pick up comments on each of the last few things. One regarding hospital visitation, I would think that whatever the hospital was using to attend to that patient, their family should be able to use. And in sometimes that might just be looking through a window, but sometimes that might be a full get up or whatever. So I think that we wouldn't have to know the specifics for that. We would just be able to recommend that whatever safety precautions the hospital personnel are using, that would be appropriate for the family to allow them in. As far as things we learned when we were talking about masks, we were talking about other things. And to me, what struck me was if you have a full system like newer buildings do, as HVAC system, you can put one item in there and it would kill, was a 99 point something percent of the virus that's in an airborne virus. I mean, we're talking about different things, but in an airborne virus. And for schools that don't, they could put individual things, but in the meantime, they could open their windows. And I don't think we did enough of that. And to me, that was striking, is how much effect just fresh air had. And just opening the windows in our houses as far as inside and being outside as much as possible, what an improvement that would have made. And that was one of the things that really struck me. What was the last thing you were? I had a list. I should have written them down. The last thing you were commenting on.
I don't even remember.
Oh, well, if it comes to one of us, I did have a comment to make on that.
The other thing, just expounding on what you just said, is, we closed down the beaches. And what in discussion is salt air actually helps get rid of viruses along with the sunshine and everything else, which also produces vitamin D and everything else to help people. Representative Leckis.
Well, along those lines, one of the things I think our state did very well was encouraging people to get outside, was having the state parks open, was encouraging people to go visit them. I think that was excellent, given that there were other states who were arresting people for mowing their lawn. So that's something that I think we did very well.
Representative Belcher.
Thank you, Madam Chair. And I would tend to agree with that. At the state level, I think there were some positive decisions made as far as keeping outdoor areas open, accessible, and whatnot. However, there were some exceptions to that were not strictly at the state level things we could look at. For instance, we mentioned closing the beaches. That was a decision made at the local level. But we are a Dillon's rule state. And Dillon's rule means that individual localities can only do what they are allowed to do as has been delegated by this body and the one on the other side of the wall concurrently to them to be allowed to do. So if we didn't want them to have the ability to shut down the beach, we could make modifications to that in law. And also at the federal level. I know this because I live a bit further north, and I know that the federal government shut down the White Mountain National Forest. All the hiking trails, all the nature, the campgrounds, they were shut. And while, again, at the state level, we made some relatively smart decisions to keep things open as we could, as far as outdoor things go, I think we really need to look at, again, the local decisions that were made and whether they ought to have the ability to make those decisions under such a case, and the federal matter of shutting down one of our greatest natural resources in the state, the White Mountain National Forest, as well as the other federal parks and lands in this state. I think that ought to be looked at pretty hard. Thank you.
And just touching on both of what you're all talking about being outside, and bringing back in both our speakers from a few weeks ago, the social distancing number, because we're still asking people, and I think one of the reasons the beaches were shut down is because of social distancing, not necessarily because of the crowds. And what we discussed was there was no scientific basis for 6-foot social distancing. Now, I don't know about everybody else, but I just assumed, and shame on me, that that was done scientifically, and it wasn't. There was no scientific data. It was a random number that the federal government came up with, and everyone ran with it. And Representative Belcher.
Thank you, Madam Chair. And I would just add to that we received testimony in this committee that the state of New Hampshire actually used, I believe it was a 3-foot rule recommendation when it came to schools, because it was impractical to conform with the 6-foot rule of the federal government given our school situation. So we went with 3 feet. And apparently some people thought that was good enough, even though the federal government was saying 6 feet. And it doesn't seem like either of those had any basis in evidence-based science. It was simply a matter of guesswork. Somewhat in the same manner of, although perhaps a little more understandable, this idea of the Swiss cheese approach that they took to mitigation, where they decided to throw everything at it to basically see what stuck. Unfortunately, what that meant is there was so many confounding variables that you couldn't tell if anything worked at all, or if anything had a negative effect individually. You could tell the full series of precautions together. You could say, well, this may have done that. But each individual item within there was really no way to control for all the other variables to see what, if anything, worked. And I think we can say generally the cumulative effect of that, I can't say a number as terms of efficacy, but I can say that overall was not efficacious, because it seems like just about everyone in this state got COVID, regardless of what precautions they took.
I agree with you 100% on that. And what I am seeing is that people that weren't vaccinated getting COVID, people that had one vaccination getting COVID, people that have been double vaccinated getting COVID, and people that have had every vaccination getting COVID. So I don't think, I understand that they were concerned about overloading the hospitals. Obviously, that's what we were all told, that the reason we were doing everything is because they didn't want to overwhelm the hospitals. So I kind of understand, maybe a little, but I really don't. Once they found out that the hospitals weren't being overwhelmed, when, why not stop? Or why not pull back on something? Representative Leckis.
Yeah, I was thinking about the effect of people who could not get in to see doctors and who had appointments canceled, et cetera, because they were trying to make sure and leave that open. But one of the things we haven't looked at yet is the harms that were done to the people because they couldn't get the appointments, et cetera, that they needed to in a timely manner.
Representative Belcher.
Thank you, Madam Chair. And again, to follow up on that same line of thinking, and I would love, and I very much hope if we get some real experts and people in here from hospital associations, from hospital owners, from hospital administrators to give us some good hard data on this, because it is my understanding that because there were a combination of mandates and recommendations that caused people to not be able to pursue normal healthcare. There were people they just shut everything kind of down. They weren't taking normal patients for everyday kind of things. It's my understanding that hospital capacity was reduced because the lack of income to hospitals actually cause and the emptiness actually caused people to shut down to cut back on total scale. So I would love to get some statistics such as we hear about the possibility of hospitals being overwhelmed. Well, how many beds were available in each hospital in this state 1 year prior to COVID? The day that COVID, or maybe January of 21, and then January of 22. What were the total availability of beds? Not availability, but the total number of beds in each hospital, in each ICU. And I want to know if there was a loss of capacity that happened as a result of this whole circumstance.
So, Representative Belcher, would you say that you would want to know, based on your questioning, how many beds were empty, how many beds were occupied in each of those years?
Thank you. I would love to know how many were occupied and how many were empty. But overall, I want to know just how many there were altogether. Because I want to know if there was a financial impact to hospitals because of decisions that were made that actually resulted in a loss of capacity within the hospital system generally.
And I think that brings us through to today, which I think this effect is still happening today. I believe I saw on the news last night, and I could be mistaken, that over in Keene, they're shutting down the ICU unit. But I would have to double check. I was sitting somewhere and I just saw something flash up quickly, but Representative Belcher.
Thank you. And yes, to that point, I would add, not just do I want to know beds, but I also want to know staffing, as far as adequate physicians, adequate nursing personnel, and any others who are required to keep hospitals functioning. Because I guess at the end of the day, if you've got 200 beds, but only enough staff to cover 150 of them, that's an important thing to know too. So I'd like to get these numbers over time, starting before COVID, during COVID, and now, to see what the impact has been to our system in general.
Representative Leckis.
To that effect, how much did the vaccine mandates affect the staffing? Because I know here, the Concord Hospital, I did talk to a number of those professionals, and they were talking, how many of them had left because they were, from what they saw, they did not want to get the vaccines and had already gone and gotten other jobs. And they were talking about how they were almost on emergency staffing at that point. So, and they didn't know what would happen once the deadline passed and people were forced to leave, they weren't sure that they could, they were predicting that people would start to die from lack of health care.
I can tell you that at the county level, and I'm sure that each of you have experienced this with your own county nursing homes, that the mandates truly did affect the personnel. But it was more than that. Because of federal guidance that came down, the contractors or subcontractors going to the nursing home had to comply with the vaccines. And so therefore they were having trouble getting work done because they had to be documented and show that they were complying with all the mandates coming down from the federal government. And not the state government, but the federal government. So I think also there might have been some disconnect into what the state was saying and then what the federal government was telling the state. And I think that's something that we really need to delve into too, is to look at what federal mandates, what did the state want to do, what did we have to do because of the federal mandates, and how did it affect our care. I know that, our nursing home, our county nursing home level dropped in the number of patients they could have. And because they deal with Medicaid and Medicare dollars, they have to be very cautious because those monies will be withheld from reimbursement if they don't comply with the federal guidance over the state guidance. And I know in our area it had a drastic effect on services at the county level. Representative Belcher.
Thank you, Madam Chair. And to follow again and kind of the same idea, I'd like to get information from, I suppose it would probably be DHHS regarding, and I think we may have actually posed this question, but I'll say it here anyway. What was known over time about the efficacy of the various vaccines and mRNA injections for COVID? It's going to play into this idea about mandates for healthcare professionals, because right now, the argument that I hear made most often for vaccination is that it reduces mortality, and that's primarily amongst the elderly. And there may actually be a net benefit to some of the people in a certain age group from the vaccine for reducing mortality. That's entirely plausible. But the only reasonable argument for making a requirement of the vaccine among healthcare professionals would be if it actually prevents you from spreading the virus to your patient population. That's the only reasonable argument to be made for it. And it seems to me that by the time we had one or two boosters rolled out, it was evident that the ability of these vaccines to prevent the spread of the virus was at best minimal. Again, there may be a benefit to mortality, especially in a certain age group, but what was originally said, the idea that this came from federal officials, said if you get the vaccine, you will not get the virus. Well, it didn't take long for that to be demonstrated to be inaccurate. And as I said, basically almost everyone seems to have gotten it eventually, despite the presence of vaccines. So I'd like to know when we understood at a professional level that the vaccines did not have a substantial effect on the transmissibility of the virus, and how that overlaid with various mandates, especially in healthcare professionals.
That is an interesting question and very thoughtful. I didn't actually think of it that way. And I appreciate you bringing that up, Representative Belcher. Representative Leck.
As I recall, and it would be nice to get verification on this, but before and at the beginning of the vaccine rollout, the federal government was saying that it would not, it was known that it would not stop the spread, therefore everybody had to keep wearing masks. And if that was known, why were we mandating?
Well, the other question is, as we learned about mask, why did they say that we had to wear mask, and who was driving that bus, and did they have specialists looking into the micron of the virus versus the microns that the mask actually stopped? Representative Blackus.
The other thing, based on testimony that we heard, is that we've had no deaths of, was it children under 5, children under 12? I don't remember what the number was due to the vaccine, but we have had a number, I mean, due to COVID, but we have had a number due to the vaccine. And yet we are still pushing vaccinations for young people. And I would love to know why we're still doing that.
I think the bigger question is where are those dollars coming from for the advertisement of it? Is it from the state? Is it from ARPA funds? Or is it from federal funds? I mean, I understand ARPA are federal funds, but is there still money coming down for that, I guess is the question. Representative Belcher.
Thank you, Madam Chair. And my prior question that I posed applies to that situation in exactly the same manner, which is it didn't take long for us to understand as a society that this was not a virus that had at least acute nasty effects for children. The long-term effects, it's a little harder to know, but the acute phase, this was not tending to kill children. So the same argument applies, and we heard this over and over again, that effectively we need to vaccinate children so they don't kill grandma. But that argument relies on the idea that the vaccine stops the transmission of the virus. So at what point did we know that the vaccine did not actually stop the transmission of the virus? Despite possibly having a mortality benefit for populations elsewhere, we knew that it didn't stop the transmission of the virus. And did we then stop recommending this for children?
I'd like to switch topics a little bit. We heard from the Commissioner of Education, Commissioner Edelblut, who testified here that he tried to give a positive message out to people. But then we also have heard from the public that fear was instilled within them basically every day. I know I can testify to this committee that I was on a phone call. They have White House intergovernmental phone calls. And they were having one, I believe was in April of May, right after the shutdowns. And the call was about mental health of the shutdown. It was about the rise in alcoholism. It was about the rise in addiction. So early on, being on that call with people at the federal level, they knew, and I shouldn't say they knew, but based on the phone call, there was a great understanding that this shutdown would increase mental health issues, would increase addiction, would increase alcoholism, and other issues. So there were many people on that call, And as I was listening and then saw what we were doing, not only as a state, but as a country, knowing that the long-term effects of this were going to be untold, and we didn't know how many years out we were going to continue to see the effects of this, why it took so long to get the information out, and why wasn't helping people and putting things in a positive light instead of scaring everybody and putting fear into them and affecting their mental health and increasing addiction and alcoholism and abuse and delaying our children's education. Why did we let the narrative go on? I understand that we need to be concerned about public health and public policy is important. But I think sitting here in this committee listening to some of these specialists, I don't think the specialists were contacted. I think that there was a narrative. And I am truly, truly concerned that the truth was kept from us. Not totally, and I don't want to say that because I think at the beginning nobody knew. I really do believe we were all guessing. But when I'm telling you that it was in April or May of that year after the shutdowns in March, they were already talking about these issues. That's a problem, and it's something that while we're talking about the shutdowns and telling people to do this and issuing these mandates, we needed to be talking about these other issues and the effects that it could have on people, the delay in the education of their children, the delay by wearing a mask, how you're hindering a child's communication skills and the way they communicate and the way they understand. That creates long-term issues. I knew a school teacher who had a student come back to school and was so uncomfortable removing his mask because he didn't know how to be without it anymore. He was afraid. I think that in our report, although we're looking at the federal mandates, but the emergency use and the guidance, we need to be looking at the true effects and the mental health issues and how it has affected society in general. I understand that's very broad, but I think it's extremely important. Representative Belcher.
Thank you, Madam Chair. And I'd like to sort of follow up on the concept of public health. And I want to officially go on the record and offer this argument for the committee's consideration and others as to what I see as a fundamental problem that might be something we, either this committee or us as legislators, can eventually look to address. So public health is a little bit of a misnomer. Okay, so the public doesn't have health. People have health. I have health. You have health. I have health problems. The public has statistics regarding health. So when you take the concept of health away from the individual and you put it on the public, you're dealing with statistics, and immediately right off the bat, you're collectivizing. You're taking it away from the individual and toward a collective. And that lens, when you begin to look at things through a public health lens, you cannot help but begin to view people by populations, by demographics, instead of as individuals with individual rights and individual agency to make their own decisions. And that brings us into some very, very dangerous territory where, through the lens of public health, nearly anything can be justified if it is of net benefit, in theory, to the public. And it's my personal belief, it may not be shared by others, but it is my personal belief that the legitimate functions of public health should probably be seen as defense functions. And the idea of public health generally should go away in favor of individual health, individual agency, and individual decision making.
Representative Polozov.
Thank you. So to follow up on previous, could you give some concrete example as it related to COVID response, how it would be different if we would be focused on individual health instead of public health? Because I don't know if I fully understood your concept.
Sure, and I hate to get too detailed because this is more of a general concept, but I can give you one example that seems in my mind to make sense. So let's take the concept of masking to begin with. Now, this was, as we heard, part of what was called a Swiss cheese approach, where we effectively just threw everything at the wall to see what would stick, right? And from the public health lens, this was seen as a collective item to get everybody to do this thing in the hopes that if everybody did this, it would lower the total, what you would call R naught, or rate of spread of the disease, low enough to not overwhelm hospitals or cause significant individual harms to people. When if we were to look at this more through an individualist lens, we would actually see that, well, first of all, people have agency, and people are not fully rational by any means, but they do tend to make decisions in their own benefit. All right? If you didn't do that every single day, you wouldn't live very long. So people have the ability to make decisions for themselves. And if you were looking at the circumstances as they rolled out, you might have thought to yourself, well, why would I ask all of these other people to wear a cloth mask that definitely doesn't offer any protection? If I were to wear a cloth mask, that's not going to prevent me from getting sick. I might instead choose to wear an N95 or N100 mask that, although we've heard at this point that probably wouldn't have worked either because of the various issues that go on with it, at least an individual might have thought to themselves, well, if I wear an N95 or N100, I can prevent myself from getting sick. And if I'm relying on myself and my own agency and my own actions to prevent myself from getting sick and staying safe, I don't have to worry about what these other 100 people around me are doing because I'm protecting myself. I'm taking rational actions to protect myself. And when you think along those lines, it provides a lot less impetus to universally regulate everything, require everybody to do the same thing, and to demonize people who won't go along with the program because they might have a different thought about things.
So let me just understand, Representative Belcher, based on Representative Polozov's question. I had constituents that are highly claustrophobic. And so wearing a mask was an extremely emotional and very difficult thing for them to do, just even to go into a doctor's office. There were also other people that have had other traumatic things happen to them, and a mask reminded and brought up those images, and they had to relive something over again, a mental health issue. So basically, if they felt that it was better for them or healthier for them not to wear one, based on what you're saying as an individual versus a public, then that would be considered acceptable.
Yes, I think, again, when you look at things through an individual lens, where we all have agency and we make somewhat rational decisions, you can say, okay, well, maybe the mask is going to help me a little bit, but my claustrophobia regarding this is going to cripple my life, my livelihood. And you might decide as an individual that the risk or downside of that outweighs the positive side of that. And perhaps some people think, well, that's a crazy thought, but is it actually a crazy thought when that person actually almost certainly statistically caught COVID anyway, even with the mask?
Yeah, but we didn't know that people were going to, everybody was going to catch COVID at the time. I'm just going along here. We know that most people, or I know that basically not everyone that has been vaccinated, but most people that I know that have been vaccinated have had COVID at one point or another. Um, but I think that also took some time. But what I do know from listening is with the microns, which to me was even more important. But I understand what you're saying about the individual. I think one of the things that people weren't taking into consideration is how things were going to affect people's mental health. And I think that when we look at any pandemic or anything in the future, we need to look at the mental health of people, individuals. Um, you know, is it going to increase alcoholism? Is it going to increase drug addiction? I mean, these are side effects that we're not discussing. Is this going to increase delayed learning? All these issues, I think when we're looking at these mandates and even from the state level, I don't know if were looked at ahead of time. And I guess I would ask the question, were they looked at ahead of time? Representative Belcher, then Representative.
Thank you, Madam Chair. And just to help flush out what I was suggesting about the public health lens, what you were just suggesting, I think, is generally accurate because we need to take in the totality of things when we're making decisions like this. We know we've seen an increase in what we call deaths of despair related to mental health issues, related to drug and alcohol abuse and whatnot. But the difference between an individualist lens versus a public health lens, let's take alcohol for instance. Well, if we looked at this through the public health lens and said, well, if we make this decision regarding these shutdowns and these masks and everything else, we're gonna drive an increase in alcoholism and all the problems that come along with that. Well, the public health solution to that very well might be let's enact prohibition. Let's ban alcohol. But the individualist lens to that might look at that same situation and say, well, maybe we should actually let people do what they think is best from the word go so we don't have these side effects like increased alcoholism and we let people go on about their lives making their own decisions in their own interests.
Representative Lekis.
Following along on these, just from a personal point of view, with my asthma, which was very kicked up for the first while of that, anytime I put on a mask, my O2 would drop. And so basically I didn't go anywhere because I couldn't. I would have to wear a mask. But if I wore a mask, then I couldn't breathe. And I became very depressed because I'm a people person. And eventually I followed the second half of our state motto, live free or die. There are things worse than death. And that's what I decided. And I decided being so depressed was worse. And I did start seeing people outdoors without my mask, privately. So I could go places that people weren't enforcing that I had a mask on and that understood that I really couldn't wear a mask. But people, that's the individual as opposed to the collectivist.
I do believe that in the emergency orders that the governor did issue, there was an exemption for people with medically related things. And I think that's important to note that we as a state did implement that. Go ahead, Representative Bill.
That is indeed, it's an important distinction, especially from the legal front. But as we've heard, there was such a environment or atmosphere of fear, and not just fear, because we can't stop there. There was an attitude of hatred that came along with all of these things that happened. That I know some people, even if it was not what they wanted to do, were wearing masks even with health conditions because they did not want to be accosted at the grocery store by people who would be offended that they weren't taking their collectivist responsibilities seriously.
Representative Lucas.
Well, that was something that I did learn, was that people don't actually read governor's orders. I obviously had read them. I mean, as a rep, we had to know what was going on, right? And I knew that I didn't have to wear the mask, but most people didn't. And you try to go into a business, you try to go into just about any place that wasn't somebody's home, even somebody's home, and be told that's the law. And you'd have to explain, no, it's actually not the law. But people didn't know. And even when you explained that, they didn't necessarily believe you. And so there were a lot of places instituting what they thought was the law, which was not. And I was not just about masks, but about a number of things. We'd gone, the whole tracking and go to a restaurant and leaving your phone number and all of that kind of stuff. There were so many things that if you read the governor's orders, they said one thing, and if you went into any kind of business or whatever, they said something completely different because they thought they were following the law.
Well, it's kind of like a catch-22. Yes, we had the emergency orders and they were open, but they were also considered a private business, so they can enact their own protocols. Just to be clear, Representative Black.
I got that. And certainly if a private business said to me, this is our policy, that's fine. But a lot of them were doing it because they thought they were following the law. And that was the thing that I really noticed.
Representative Belcher.
Thank you, Madam Chair. And to follow with that, it's a matter of which law or which guidance was being followed. Because let me tell you, when we were at the height of the pandemic and I would go into businesses or doctor's offices or wherever, I don't recall once seeing the governor's emergency order posted on the front door. But what I did see was guidance from the CDC or the WHO or other organizations that in many cases was substantially different than what was actually the law or the executive orders here in New Hampshire. So I think there was probably a lot of confusion and a lot of people unsure of where to look. I think there was a lot of people unsure of what the actual authority was of the various entities putting these things in place, whether governor's executive orders trumped the CDC or the WHO, or whether the hospital's guidelines trumped what. Or I think there was a lot of confusion involved, and people kind of defaulted to the strictest set of guidelines.
Representative Belcher, I do agree with you. We heard here from Commissioner Edelblue, Commissioner of Education, that they sent down some guidelines, but school boards chose the CDC or the WHO guidelines. So instead of following New Hampshire guidelines, they went to the federal guidelines. And I think, I don't know how we do this in the future, but I think it needs to be extremely clear that, New Hampshire has its guidelines. It needs to be spelled out. It needs to be saying that we are actually looking out for every individual in our state. We are concerned about you. And these are the guidelines that we're instituting because we feel that it is the most appropriate for the individuals and the citizens in our state. Yes, you'll be hearing other guidelines, but those are generalized. We see this all the time, right? Representative Belcher.
Thank you, Madam Chair. And again, we can tie in whether we ever decide to put this in any report, but I would make the argument that powers such as were exercised during a pandemic, such as quarantine, for instance, are inherently police powers. Police powers are inherently a power of the state. I am not personally aware of anywhere where police powers have generally been delegated by the state to the federal government, and certainly not to any supranational organization or governance. So it would be my view that this is one of those matters under the 10th Amendment where the state authority ought reign supreme.
I do believe, though, that if you clicked on protocols on certain websites at the state level, they would bring you to the CDC guidelines. So if we have under emergency orders one set of guidelines, but then an agency's website is issuing the federal guidelines, or the Department of Education says one thing, but we're still issuing under, like, like I said, another department, the federal guidelines, there is some confusing data out there for the public. We find this all the time, especially in agriculture, confusion. So I think trying to streamline and make sure that everybody's on the same page, and maybe that's something that should go in the report, that the guidelines should be the guidelines for the state. And it should be uniform across all agencies. So I don't know how that would happen. I don't know, what the protocol of that would be, but I think it's because when people start getting conflicting information, and it happens a lot in a lot of different areas, it's tough. Especially when you're dealing with the whole emotional thing of COVID, and how many people were leaving their groceries outside and then washing them down before they brought them in their house. Or people were afraid to come outside even. I mean, even though we know fresh air is healthy, but just the fear that was instilled. But if you have conflicting information across the, how do people know what's true and what's not? Representative Polzop, then Representative Belcher.
And following up on ideas that approach that was implemented was Swiss cheese approach when everything possible was used. In reality, I think it was not everything, and we saw some mandates when some measures were hardly pushed or even mandated, but at the same time, at some time period, so for the whole period, we saw some measures were prohibited in some or other way, and like we know that in this state there was a lot of discussion if people should be it should be easier for people to use ivermectin for treatment, and there was a push against this. So it was not like Swiss cheese in this regard, like we're saying, oh, this approach is no good. Even for masking, like I probably overreacted and played on safe side. So I was one of the maybe first people who wore a 95 mask among public when like Dartmouth Hitchcock Hospital, nobody from their staff was wearing any mask, and part of it was probably trying to save PPE, saving equipment, for part of it maybe trying to not instill panic. So at some point they were like, okay, not wear mask, don't instill panic, and then they're like, now wear mask, no panic. So some measures I probably can come up with other examples. Well, with the antibodies, like for a while, monoclonal antibodies were not recommended, so it's kind of they were removed from Swiss cheese approach, and then they were nationalized, so they started to be recommended, but you couldn't do it like privately or on a state level. You had to like wait for federal government to distribute your fair share of monoclonal antibodies for COVID treatment. So it's again, it was like kind of very limited.
So, Representative Polzov, what you're saying is that although the Swiss cheese approach was applied for prevention, that was opposite of what was applied for treatment. Is that correct?
More like it was more nuanced situations than just Swiss cheese approach. So yeah, they tried to use many measures both for prevention and for treatment, but then quite a few measures that should have been used were not used. So I see it as more complex than just applying every possible measure that is reasonable.
Thank you, Representative Belcher.
Thank you, Madam Chair. Just to return to the idea of the powers and the different guidance coming from different entities, what I might recommend is that if police powers are rightly the power of the state, and these fall into the category of police powers, then all guidance that has the effect or force of law ought to be coming from the state and only the state. Now, that's not to say that people out there can't follow CDC or WHO or whatever guidance they want to because they're free people. But if it's going to carry the effect of law, it should only be coming from the state. And that also doesn't mean that the state can't do what the CDC is doing, for instance. It just has to adopt it as the state's guidance, not CDC guidance, to say this is our guidance, which means they have not only the authority to do it, but they also carry the liability of doing it. Because one of the biggest problems I see with this whole situation is that it seems like the entire thing has, from the federal level to the WHO to the state level to the executive to everywhere, it seems like it's formed a web of bureaucracy that has managed to spread responsibility and liability so thin that nobody can be held to account for anything, and the buck doesn't stop anywhere for anything that happened. So it seems like, for my 2 cents, state only should be issuing guidance that carries the effect of law, and it also shouldn't be able to take any federal dollars that come with requirements to issue things that have the effect of law, because that violates the 10th Amendment and the separation of authority and powers between the state and federal government.
Could you expound on that a little bit when you talk about that we shouldn't be taking federal money? Thank you.
Thank you. In this particular case, what I mean is that if there is federal money that comes with any mandates that we're going to affect on the people that would represent police powers, because everything we do, from requiring masks to quarantine, those are all police powers. So the federal government isn't really supposed to have police powers. So if they're trying to get around that by saying, well, we're going to give you money, but only if you enact these police powers, that's actually a violation of the separation of authority between the state and federal government. And that should be, in my eyes, that should be considered unconstitutional.
So maybe when we have Director Buxton, and we will be able to find out if there were any mandates, any strings with dollars.
Indeed.
Representative Lekis.
Something that was touched on that I think we really need to focus on was the treatments and the limitations of the treatments. There seemed to be an awful lot of doctors and hospitals who were part of organizations who could not give treatments that private doctors were giving very successfully. And I would like to know more about how that all came to be, who was making those decisions, and why were many of the pharmacies, even if a doctor prescribed one of those medications, like ivermectin as just A, for example, why then were they unavailable? Why were pharmacies refusing to fill them when that was a medicine that is not in short supply?
So Representative, let me see if I understand what you're saying. You're saying that private doctors were issuing different medications than, say, and I'm confused about private versus others, okay? If you could expound on that a little bit. And the other question is, are you saying that pharmacists in New Hampshire were refusing to fill a prescription from New Hampshire doctors?
So the private versus organizations, the doctors who were part of organizations were being told from higher up in their organization, you can't do this or you'll be fired.
So when you say an organization, so well, I'll just use so like you have Concord Hospital, and you have a lot of doctors under the umbrella of Concord Hospital. Is that what you're considering an organization?
Yes.
Versus like a concierge doctor or someone in private practice?
Like somebody who's part of, say, Dartmouth Hitchcock, for instance. Dartmouth Hitchcock doctors all had to follow Dartmouth Hitchcock procedure, all across the state. If they were affiliated, they had to follow whatever those guidelines were. Those with Southern New Hampshire, which I forget what their current name is, but those had to follow those rules. And if you were a private doctor who was not affiliated with anybody else, you could then, because it wasn't federally illegal, you could do things that you could not do under the guidance of whoever oversaw or without threat of being fired.
Okay. So you just said something, and I just want to see. You said federally illegal. You said that they could, so I'm trying to really dive into what you're saying there. So if you could,
Okay, so partly it's what you prescribe, and it might be FDA approved, but you can't prescribe it because you've been told not to. But another part of that we came across was getting medical exceptions for taking vaccines. And where did that guidance come from? Because there were doctors, there was one that I know of who really wanted to give a medical exemption for one of his patients. It was a nurse, so that she didn't have to get vaccinated in order to keep working, and was basically said, I can't give this to you or I will lose my job. That's coming from above. But he had already told her, I don't think you should ever take another vaccine. From the reaction you had with the last one, you may have a complete allergic reaction, which she did. And apparently within like 7 seconds of having died from the amount of time she wasn't breathing before they were able to start her breathing again after she got the vaccine. Where did that come from? Who made those decisions?
okay, so I'm just going to rephrase this just so for understanding purposes, and I think it ties into what the mom that we heard testimony from said, was that the daughter had some issues and felt like she shouldn't get the vaccine, but the medical doctor said, no, you should. This person here, the doctor knew that this person should not receive the vaccine. However, he couldn't give her the exemption because the organization or somebody says you cannot give any medical exemptions. So the nurse, it's my understanding based on what you just said, did receive the vaccine, and she had a terrible reaction and stopped breathing. So the question comes is when the medical industry says they will do no harm, even though they're told that they know something is going to be harmful to someone, but they're taking their but then they have to weigh in their livelihood over something that's harmful. What does that do to that particular doctor, especially knowing that this person, just in order to keep her job, was trying to avoid exactly what that doctor told her not to do. He couldn't follow his own guidance and knew it was medically right for this person. So there seems to be a moral conflict somewhere in here. And I think that's something that's important to note. And you're not the first person that has told me of a story similar to this. So this isn't, it's more prevalent than what we would think. And it should be cause for concern for everybody, because if they're telling you over something that they know is going to harm you because of your condition or something, how many other times are they doing that in other instances not related to COVID? Representative Belcher.
Thank you, Madam Chair. And on a very similar topic, I would love to get somebody who's capable of testifying, particularly to the expert analysis of scientific study, because one of the things I've heard more and more recently, particularly regarding some of the pharmaceuticals that we've been sort of alluding to here, is that there's this concept within statistics and analysis called a funnel plot. A funnel plot. And the idea is that within a sort of meta-analysis of studies, meaning you're looking at a bunch of different studies on the same topic, that you can apply this concept called the funnel plot. And it will give you an idea as to whether there has been bias in the published research. And what I've heard is that an awful lot of pharmaceutical research that comes out these days actually fails the funnel plot, which suggests that there is selective publication of certain themes, either for or against certain pharmaceuticals, as if there's a bias involved. So I would love to hear more about that from experts in the field, to learn if there is indeed bias on the part of the major journals who are publishing these sorts of research, why that might be. Are there incentives in place that would cause that to come about? Is there ideological reasons? Are there financial reasons? And what ultimately recommendations we might be able to make to correct any problems that might exist.
And could you tell me where under our purview that would kind of fall?
Sure, because we there obviously within the state level there were recommendations and or mandates for various pharmaceutical products, both in terms of preventatives and treatments, that would speak to whether or not the expert evaluation of these pharmaceuticals were subjected to a bias-free evaluation, or whether there was a incentive structure or narrative or ideology or anything else in place that might have tilted the balance away from pure science and towards something else.
So what you're saying is not only the mandates for preventative, basically the Swiss cheese approach, but there were also mandates for when you when you had COVID, and there were mandates by the state.
Sure, mandates and or recommendations. But in either case, mandates or recommendations would have certainly been based on what would be called consensus or expert opinion. Expert opinion would have, of course, taken into account the publications in major research journals, everything from science to nature. So if there's a problem at the heart of that, right down to the possibility of bias being introduced at the level of publishing in major research journals, that would trickle down all the way to the guidance and mandates being recommended by state personnel regarding both treatments and preventatives for COVID. And if there's a problem there, I mean, if there's a problem at that deepest level, that would taint everything all the way down the line. So I'd like to know more about that.
And I'm just going to be a little adversarial here. I mean, there's bias in everything. So I guess the question is, I'm a numbers person. It's kind of black and white. They either say this or they say that. You really can't manipulate them too much. So what you're saying is the data being purely presented as the data, or is it being manipulative in some?
Yes, and I would like to do that. I would like to hear that's why I want to hear from an expert in scientific and statistical analysis who can come in here and explain to us what is a funnel plot. Is it true that within pharmaceutical research, it often fails a funnel plot such that it highly suggests bias in publication, and why that might be? Because again, we're science-based, and I want to do this in science by the numbers, and statistics is, I think, one of the better ways to go about looking at that. So if it fails a funnel plot, if there's evidence of p hacking, which is a way to manipulate statistical results, I think we should know if that's happening or not.
Representative Polozov?
Thank you, Madam Chair. I want to follow up on Representative Leko's testimony, and in my view, it's important for us to try to understand where it came from when people were denied proper exemptions from vaccination. And we know it's not limited just for hospitals. We heard many stories about military personnel were widely denied any exemptions. I personally know New England policeman who was fired because he was in the process of getting exemption, and it was impossible. It was made impossible. He was not the only one, and it took him, I don't know how many, like 2 years, how many. Finally, a number of them won in the court and were reinstated, but the damage was already done to the public and people by denying exemptions. So yeah, it's I want to know why doctors were pushed and who pushed them to deny proper medical exemptions.
Representative Belcher.
Thank you, Madam Chair, and thank you for that, Representative Bolzov, because that is actually an avenue I would like to explore a little bit as well, because it does seem to me, and I'd like to explore a little bit of the case law history and whatnot behind this, because it seems to me that historically, when people were to seek conscientious or religious exemptions, they would simply do so and say, I have a conscientious or religious exemption or qualm with what is being proposed. And at that point, the burden of proof would shift to the person administering the exemption to require a hefty burden of proof to disprove that claim before they could deny it. But what I saw under COVID, and I experienced this with close friends of mine as well, was in some cases, it was flipped seemingly so that the burden of proof was placed on the person requesting the exemption to such an extent that they would require letters written from their pastors requiring specific scriptural references to why this is not in line with your beliefs, your sincerely held beliefs, as well as requests for your own medical history. And if you had ever, for instance, had a flu vaccine before, you're going to need to explain why this is now different than that. And a really, really extremely high burden of proof was placed on some of the people seeking exemptions rather than the other way around, which seems like the more historical and appropriate thing.
If anybody knows anybody that has that background that could come to the committee, just please contact us and let us know, and we'd be more than willing to hear from them. So, yeah, there's a lot to go through here, and you know, as we think about what we're doing, who we're going to be hearing from, and of course, we'd always love to hear from the public. We also have to be thinking about how our report's going to look and how we're going to put together that. So, just want to throw that out. Representative Belcher.
If I may, if this is an appropriate time, I'd like to offer some thoughts as to how I sort of envision the most sort of possible ideal looking report might look. So I was thinking, I think the best way to start at the 30,000 foot view is to start by breaking it down topically. I think to do it chronologically would be too difficult to cause people to jump around and try to find instances of whatever they're looking for in 10 different places rather than just one. And then within the broader topical breakdown, in order to maintain a uniformity between each section, I think we should have the same sort of chapters or whatever you might want to call them within each topic. And I think those should include testimony received, which will not be comprehensive, but it will pull out selected testimony that is impactful and pertinent to what we're doing and say, this is what we've received. This is what we've been told by members of the public and experts. A section under each topic for any persons who have made allegations or grievances for us to examine. Incentive mechanisms that may have been established by anyone. Impacts on constitutional rights. Our role in sure. Incentive mechanisms. Impacts on constitutional rights. Our role regarding judicial and executive oversight, federalist or federalism implications, state-federal relations, a section on demonstrable facts, which will probably be one of the shorter ones because it's actually going to be hard to fully establish what is uncontrovertibly fact versus mere probabilities. A section on areas of variable certainty or uncertainty. I kind of envision that more like an intelligence type breakdown where we can attribute a medium, low, or high degree of confidence in various items that we're looking at. areas for further investigation and by whom should that be conducted, recommendations and avenues for redress of grievance, recommendations for legislative action, and recommendations for future emergent events, such as other pandemics. And of course, I think all of this should include positive lessons learned as well, things that we might have done well comparatively to other states, other nations, as well as the, of course, grievances that we have received.
I thank you for putting that together and being very thoughtful on that. I think it's important that we highlight the positives. But I also think it's important that as we look to the future, and just in hearing from Dr. Kuldoff, the infectious disease doctor, that when we look at another pandemic or something coming down the pike, that we really need to look at, break it out by demographics or age groups or who's the most affected, and roll out protocols accordingly as we learned. Because I really truly believe that the mental health of the public should be at the forefront of the mental health of the individual, I should say, should be at the forefront of everything that we do. Because I have a saying that attitude is basically most of everything. And keeping positive and knowing that we're going to get through things really has a lot to do with health. And I think we need to make sure that when we roll something out or do something in the future, we also, it shouldn't be all doom and gloom. We really need to put in that there is a solution, that there is an answer, that there is positivity. And I think positivity is something that we really, really need to stress, because I don't think that was done during the pandemic. Representative Lekis?
There's a book that I read that looks at survivors, and they looked at a plane crash in particular, and those who survived and those who did not, even though they might be sitting right next to each other in the seats, and they looked at the differences, and they looked at then other instances, and they came up with a number of criteria that helps with survival. And perhaps that's something we should look at and think about for the future. It's like, how did we or did we not do those things? Because part of that is the attitude. There are a number of things like that. And for instance, the whole fear-mongering works to the opposite of survival. And so perhaps that is something to look at, and how did we push or promote the things that work towards survival, and how much did we push or promote the things that work against it, and what can we do in the future to work towards survival?
Representative Belcher.
Thank you, Madam Chair. And to go into the same topic, and mental health obviously being a very important topic. I know myself and perhaps some others here have just recently finished a book by Abigail Schreier called Bad Therapy, going over some of the really detailed analysis and speaking with experts and interviews as to sort of the nature of our therapeutic environment that we find ourselves in. And one of the things that really stood out to me in that book was that resilience is the default human position. Absent any other, intervening things, people tend to be resilient. And that can be demonstrated based on looking at things such as the variable PTSD rates in different populations. Populations that are relatively, well off, yet steeped in a therapeutic environment, actually find that they have very much higher PTSD rates than populations that have very difficult lives. but are not steeped in the therapeutic environment, and how that direction may have played into our pandemic response in a detrimental and paradoxical way.
Could you go into that just a little bit further? Because if I heard you correctly, just want to make sure that the people that had more difficulties and didn't have therapy readily available had less PTSD than those that were more affluent and had therapy readily available. Is that correct?
Kind of, not exactly, but kind of. So it's not exactly therapy readily available. It's more a matter of being steeped in a therapeutic environment. And so let me expound on that. The idea of rumination, the idea of sitting with yourself in your thoughts and thinking about yourself. And it's been said by some particularly famous therapists that there is little difference between sitting around thinking of yourself and being depressed. It is like almost the same thing. So those steeped in a culture of rumination and thinking about themselves more tend to have worse mental health outcomes and more diagnoses than those in more difficult circumstances who don't spend time ruminating. Another way to look at it is your mindset. There's two primarily different mindsets you can take toward the world. One is a mindset of self, and one is a mindset of task. The first mindset being you're spending your time, you're looking at everything through a lens of how is this affecting my mental health? How am I feeling about this? The other mindset is how do I get this task done? And what you find is that the more time you spend in mindset A, thinking about self, the worse mental health outcomes you are, and the less you are capable of getting done in life, which also affects your mental health, than somebody who is task oriented. So it might be worth exploring how we responded in terms of mental health to this pandemic, in terms of did we promote rumination? Did we promote this therapeutic mindset of sitting with yourself and thinking about yourself, which is functionally no different than being depressed? And how did that impact us versus could we have directed people in a task-oriented way with goals where they might have actually felt good about themselves and brought people together instead of the alternative?
Representative Lucas.
Just following on with that, how much did the lockdowns contribute to just sitting around looking at yourself as opposed to being able to do things?
Representative Polozov.
Yeah, to follow up on last two, for me, the focus is more like people need to information to act upon. Like there was some active measures, like people were thinking how to create more masks or like how to brew their own hand sanitizer. But for me, focus is more like instead of informing people, it was more like instilling fear with constant daily press briefings, but also like focusing on number of people who died and all the negatives that comes with it. And it was always some running line in the news and more on federal level, but on a state level it was similar. So for me, in this case, it was of course there was place for rumination, but there was a lot of fear. even without rumination, people were just scared.
If anybody has anything else they would like to say or discuss, I did have this continued for 1 o'clock. I don't know if we need to do that or, and I'm not sure what the protocol is where the meeting is listed. Representative Blackus.
Well, when I talked earlier about treatment protocols, we then got off into medical exemptions, et cetera, but I still would like to pursue medical protocols and the fact that there were out there and published medical protocols that were being successful, and then the inability to follow those protocols, and just basically where did that come from, how did that, et cetera.
Is that something you'd like to discuss this afternoon? Go into depth more, or?
No, I would
Okay.
like to have, speaking of somebody to come in and
Okay.
talk to us, you know, we read all those things. Of course, they kept being saying,
So it would be nice if we could get someone from the hospital association in here, and I will see what I can do. But if anybody else knows, Representative Belcher.
Thank you. I think we've covered just about everything that I wanted to get into here today. There's one final thing I'd like to do with permission to make an appeal to the public regarding regarding advertisements. Now, we seek to get to the bottom of issues regarding what guidance was issued, as well as different funding and what mechanisms may come along with that. In order to do that most effectively, I believe we would like to have in hand any advertisements that were made for any treatment or guidance or protocols or anything of that nature made by the state of New Hampshire or affiliated persons, whether that's a picture that was taken of a billboard or something from a magazine or any of the above. Because if we have those in hand, we can ask specifically to this advertisement, was this bought with state funds, with federal funds, what strings were attached to it? And I'd like to have all of that as part of our record. So if any of members of the public watching have any of that, please find it, give it to us, email it to us, bring it in to us, however you'd like to. We would like to have copies of those advertisements in hand.
Thank you for that. Anybody else? Okay. Well, then I will adjourn the meeting. And thank you all for attending, and thank you all for everything. Everyone have a wonderful weekend. It's going to be beautiful. Sunshine.